It's been more than a year since COVID-19 was declared a pandemic. The virus has taken a toll on the physical well-being of millions of people around the world, but it's also affected everyone's mental health in some way, whether it's stress, anxiety, depression, isolation, or substance abuse. If you or someone you know is feeling added mental distress, we'll explore what help is being made available. Tonight's live broadcast and live stream of Insights on PBS Hawaiʻi start now.
Aloha and welcome to Insights on PBS Hawaiʻi. I'm Yenji Denise. As the COVID-19 pandemic drags on, experts are sounding the alarm about another crisis, one that can leave invisible scars. It comes after we've all been exposed to a roller coaster of emotions, from fear of the virus, economic uncertainty, and social isolation, to now new hope with vaccinations. But it can be hard to process, and it's not just adults who are struggling, but children as well. Our panel tonight will discuss the importance of addressing these psychological challenges as part of our overall health and well-being. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaiʻi.org and on the PBS Hawaiʻi Facebook page. Now to our guests. Kathleen Merriam is a licensed clinical social worker and a certified substance abuse counselor. She works at the Department of Health Adult Mental Health Division and is the team leader for the Kumakani Hawaiʻi Resiliency Project. Kumi McDonald is the executive director of the National Alliance on Mental Illness Hawaiʻi. The organization provides free support, education, and programs for families affected by mental illness. Dr. Sonia Patel is a child, adolescent, and adult psychiatrist. She grew up on Molokai and received her training at Stanford University and at the University of Hawaii John A. Burns School of Medicine. And from the Garden Isle tonight, college freshman Tavia Raposo. She's a mental health advocate at the Boys and Girls Club on Kauai. Last year, she was named Boys and Girls Club Hawaii State Youth of the Year. Thank you all for being here tonight. We truly do appreciate it. Dr. Patel, I want to start with you. Life in general is stressful, but what is different about the stress that people are experiencing because of the pandemic?
I think one of the main things my patients talk about is just the lack of control in a lot of areas. I mean, if you look at social determinants of mental health, like job loss or issues of structural racism that have come up even more this year, economic instability, and things like that, it makes it really difficult for people to be able to cope with those issues. And I think, can you repeat the question one more time?
I'm just interested to know on what's different about the stress of COVID-19 in this last year versus the stress that we experienced pre-pandemic.
Absolutely. Yeah. So with those kinds of issues that have come up, and social isolation, it's been harder for people to reach out and connect. It's been, they've had to deal with a lot of these things on their own. So a lot of the things that they were able to depend on prior to the pandemic are no longer available. So they may end up really alone in how to deal with these things. Mm-hmm. Yeah.
Kumi, what are you seeing in terms of how that actually plays out? How that expresses itself, and what people are doing to cope?
Well, we noticed that as soon as the pandemic hit, it was an uptick in requests for services. And we noticed that people were in crisis. A lot of parents were calling and saying that their children, it's the first time they've seen this in their children, or even older people have said, I've never seen my husband act this way. So there's a lot of people coming out with new diagnoses. And, so how we did it was that we started right away. We were one of the first in the nation to start support groups on Zoom. And, we have a pretty young staff that was able to do that for us. And we were able to get services right away to meet the needs of the families and of the individuals struggling with mental health issues.
And how do those Zoom meetings, how do we know that they're working?
Well, I just talked to our program director, who happens to be one of the leaders for the peer support group for people living in recovery. A couple of months ago, she was I don't know how I'm going to take care of these people. Some of them are in crisis. They have suicidal ideation. Some just came out of the hospital. And I just talked to her yesterday, and she said those same people continue to come every time to our support group, and they're doing so much better now. So we do see that the support groups are helping. And she said the other support group the other night, everybody was in tears and just saying how grateful they were for each other to support one another.
Yeah, we really do need community right now. Kathleen, I want to talk to you. Kumakani Project, of course, was started specifically for COVID crisis counseling. Can you tell us a little bit about the services that you offer right now? And while you answer that, we want to show our viewers some numbers that they can call for resources.
Sure. So thank you. Kumakani is basically on a FEMA grant that the state of Hawaii got, basically because it's an emergency. And it's due to the pandemic. It's a time-limited project, so people can call now through October during this difficult time to get some extra help. So you call the crisis line. It's the Hawaii Cares line, which is our one-point entry into the system, and it's that 1-800-753-6879 number. There's a Kumakani call center in every county. And Kumakani is offering, if you go to their website too, that's a great resource. If you go there, you can see that you can get individual counseling as well as group counseling. They're offering all kinds of groups. Groups have proven to be very helpful during this time. It's great if you can get into an individual counselor, but not everybody's able to get into one right now, especially now. So groups have been very, very helpful for folks. There's groups on yoga, on benefits, on unemployment, for essential workers, so a wide range of groups. And with our community mental health centers, for example, we have been state operated, so we are essential workers. We never did close. So now what we're finding is there's a transition for the clients really to, they didn't come in a whole lot only for emergency, but now to come back on a regular basis. There is quite a transition that's going on.
Tavia, I know that we brought you on here to focus on young people. Can you tell us what specifically young people are facing that might be different than what adults are facing during this time?
Yeah, most definitely. If I'm being honest, I can definitely see a trend in similarities between the older generation as well as the youth. A big one being the lack of motivation. I found that a lot of youth are struggling a lot in terms of focusing on school or finding the motivation to complete schoolwork, or even showing up to class even feels like a hassle for them. And that in and of itself is worrisome because from my perspective, I see the youth as a light in the future. And if they decide that they want to throw away their academic career or that they want to put aside sports or anything that means something to them, you can definitely see that declination in the way that they used to perceive life up until recently. And that in and of itself is very, heartbreaking to watch.
Yeah, and because of that, how has the Boys and Girls Club been able to keep those social connections and to keep their members in touch with each other and to keep that social aspect? Because we know that, at all stages of life, of course, being social is important, but particularly for, adolescents and young people.
Yeah, so at the start of the pandemic, we were originally doing Zoom programs. So we would Zoom in with youth. There's a specific one for elementary, and then we would do another one for teens and middle school and high school. But luckily now we were able to transition into being in person while following CDC guidelines. And it's been amazing to be able to see the youth grow from when we first entered into the pandemic, when they were struggling again with socializing. Being able to talk to one another seemed like such a difficult and hard task. But now they seem a lot more comfortable, and they're finding that sense of familiarity again with being able to communicate with one another and being able to bond.
Dr. Patel, it just seems like that peer-to-peer experience is so important. What are you hearing from parents about the challenges that they're seeing in their children and how they can help to, navigate this with them?
Absolutely. Parents are really concerned. There's definitely I'm getting almost 5-6 calls a day for new patients, which is pre-pandemic. It wasn't like that. So there's a big need. Parents are noticing things, and they're noticing also because if their kids are at home, they're seeing the isolation. They're seeing their kids, like Tavia was saying, not being motivated or not doing the things they normally loved. Some of the parents are calling because their kids are in college, first year college. they went away, but it's still all on Zoom. So they're very isolated and their kids are coming home because they're really depressed, just to the point of being suicidal. So parents are noticing things and they're calling. And in terms of what they can do, I think definitely to keep the communication going, to talk to their children, to not be afraid to ask tough questions, even questions like, are you having suicidal thoughts? Do you want to hurt yourself? I'm really also asking about substance abuse, because a lot of the young people I'm seeing have started using substances to cope, because they don't have their other normal coping strategies anymore. And I think also reaching out for help. I mean, it is hard to get an individual counselor, as Kathleen was saying. Definitely, it's tough, but there are other resources out there. And I know the NAMI website has great information, but to definitely reach out for help.
Yeah, Kumi, can you tell us about some of those resources that are available, Kumi, for teens and for youth, and also for parents who are trying to help their kids go through some of this?
So NAMI is about community, and it's about giving the support system. So I kind of equate it to similar to AA and Al-Anon. We're kind of, if you're someone living in recovery from mental illness, then we're kind of like an AA support system. We have education classes, we have support groups. And then again, for the families as well, education, 8-week course on how, step by step, how to care for somebody with a mental illness or a mental health condition, how to communicate with them, how to set boundaries, how to, as a caregiver, practice self-care. And then for the peers living in recovery, we talk about coping skills. And like Dr. Patel said, instead of running to the alcohol or to the drugs, we teach them healthy coping skills. And we've been doing a lot of education for youth, going to schools via Zoom, talking to classes and colleges, all, Rotary clubs everywhere has been inviting us to talk about mental health. And now we're kind of going with the approach of, let's talk about mental wellness. So a lot of people maybe are not quite mentally ill, but let's prevent it. Let's talk about how we can prevent stress and practice healthy coping skills. And it's, again, the community.
And tell us a few of those, if you would.
Well, I live in recovery from depression, anxiety. And so right before this Zoom meeting, I did my yoga, I did my prayer and meditation and did my breathing to get centered, so some of those things, but even just going out in nature, right? Enjoying things with your family, sense of community, practicing your faith, going for a walk, and eating a lot of greens. They said just increasing fiber can help a lot with your mental health. So those are just some of the things that I practice.
Kathleen, we're talking. Oh, sorry. Go ahead, please, Dr. Patel.
Oh, no, I was just going to say, one of the things I wanted to add to what Kumi was saying is I like to tell my patients to live in the moment now, not to forget to live in the moment, because although we are not in lockdown anymore, but still in this strange time, we're still living, we're still alive. Try to be present. That's a very tough thing sometimes.
Kathleen, I want to get to Michael from Maui has a question, and he says, is refusing to wear a mask or being too obsessive about mask wearing a form of mental illness? I think that, for so long we've been trying to protect ourselves, and so here's something tangible we can do. On the other side, obviously there's a larger political debate. This public health issue has become a political debate about whether or not to wear masks. But how do you see this expressing itself, the stress expressing itself, and what would you say to Michael from Maui, who's asking about perhaps some obsessive tendencies when it comes to protecting yourself?
That's a really good question. Now, Dr. Patel is more into the diagnosing of people, but I can comment a little bit on, anything that gets what he's describing is, he used the word obsessing, I guess. But if something's taking over your thoughts and is taking over your energy and your ability to function every day, then we know that it's to the point where it's unhealthy, right? So I think that our goal is to be healthy and safe and respectful of other people as well. So I think that it's important to pay attention to what's going on around us, to know what the norms are. And I think for most of us, we are paying attention to wearing masks right now and being healthy. um, and and trying to stay within a norm. And right now the norm is to pay attention to the CDC guidelines. But the point here would also be that if we go outside of the norm and start having some thoughts that take over and impact our daily living, our ability to function, then it could be an indication of a mental health condition or a problem. And it's always good to seek some advice or help if you feel like it's to check it out with people, to talk about it. And if you need to seek some professional help, that's I think a great thing. It takes a lot of strength, by the way, I just want to say, to ask for help. We have this stigma about, people that maybe it's a weakness, maybe it's a sign of, this real illness, but it actually is a really sign of strength to go ahead and ask and talk about maybe the need for help.
Tavia, I wonder if you would address that idea of, how a young person can reach out for help. And on the other side, if you see a young person who you're concerned with that might be struggling, what do you think is the best method to approach that person?
Yeah. So from my personal experience, I found that most times, often if not, youth are specifically, they're not going to talk about their feelings as much. If anything, they're more than likely to push it to the side. And if they do decide to talk about it, it's on their terms, it's not on ours. If anything, the best thing that we can do in our position is to create an open and welcoming space and saying, hey, if you ever need to talk, or if you have something on your chest, I'm here and I'm here to listen for you. So that's pretty much all that we can do. But it is also good to check in, asking, hey, how are you doing today? Has anything gone wrong in your life? Any questions like that. So basically just checking in and letting them know that you're there for them is the best that you can do.
Yeah, that is so important.
And can I add something?
Of course.
As a mother of a teen, I realized with the first set of kids that I had, they're a little bit older, I didn't practice all of these self-care things or verbalize mental health in my everyday language. And so when my older son came down with depression, it was a lot harder for him to express his feelings. But I have a younger son who's a teenager still in the house. And but when he was growing up, I was already verbalizing, I was already practicing, hey, let's all talk about our feelings. Let's get mentally healthy. So when he was struggling with a little bit of anxiety during the pandemic, he was able to come out, Mom, I need help. I think I'm going through something. And we were able to work through. We breathed together. We practiced prayer together, meditation together. And he was able to, cope with it. So I think just being a practicing person really makes a difference in helping your kids. That's just my personal experience.
Yeah, I want to follow up on that. I think there might be some parents watching tonight, and how do we know if our kids are just being teenagers or if there's something more serious going on? How do you start to have that conversation? Kumi, I just
For me?
follow up.
Oh,
Yes,
okay.
please.
So I would, I know that Dr. Patel, everybody has some great insight, I'm sure, but from the NAMI perspective, it's about just asking the questions, paying attention, and then again, practicing what you preach, right? So it's like they say that if you eat vegetables, your kids will eventually eat vegetables, right? If you exercise, your kids will probably grow up to exercise. So in that sense, I think if we're living it out and just taking a moment to just spend time with our kids and check in with them, I think, and make it a regular practice. So I think when my son, my teenager who was still at home in the very beginning of the pandemic, he didn't verbalize as much, but I was consistent in checking in with him. Even if he's like, I'm fine, Mom, it's like checking in. Okay, what's going on? How are you feeling? And eventually we talk about it like a regular topic now, just like, if he has a stomach ache or if he's not feeling emotionally well. So it just takes time, but be persistent and be patient.
Yeah, and normalizing that conversation. That's wonderful. There's a caller from Kailua. I want to address this to Dr. Patel. What are the possible lingering effects of pandemic-related stress, and how do people cope with them? I think that one of the things that's been so tough about this is that it feels never-ending. When do we get to the end of this? The governor likes to always say that we're going to get to the new normal, that there is no return to normal. So what are the effects of being under stress for such a long time?
I think we have to look at this as a trauma. I mean, it was very sudden when it happened. a little bit over a year ago. And then the effects were not only immediate, but severe. And even after it's starting to get better, but there's going to be a delayed trauma response. And that's like any other trauma. When people go through stress, and someone was speaking earlier about how, mental illness is viewed sort of different as medical, but it's really all the same. When you go through trauma, there's cortisol release, there's stuff that happens in your brain. It's actually very biologic. So depending on the level of stress you've had, there is going to be a delayed effect. So I think the mental health things that are being put into place, or the increased funding, or hopefully all these things that are going to happen for mental health, needs to be like never backed down on, because we're going to see at least a year or two out some delayed effect of these things. I mean, some of the kids that are coming back from college, because this year has been so tough on them, they're just now starting to look back and go, this year has been slowly going downhill for me. This is why. And then it takes a year or two to sort of recoup from that, because you missed out on that developmental, that very important developmental time period. So I think we're in this for the long haul.
Yeah. How do we recoup? I just want to follow up on that. How do we recoup when we're essentially still in it?
Yeah. It's sort of like the whole point about living in the now. It's really focusing on, and other people have talked about this, but the self-care, really thinking about each day, creating some sort of structure, right? Because we can't control what's happening around us, but we can control what's within our realm, and figuring out what that is, what's important for us. I like to tell my patients to have structure, things that if they have school, or if they have things like that, that provides some sort of structure, but also self-care structure, things that they enjoy doing, that bring them some peace, right? And then definitely some connection, but not to just sort of wait till things are over to sort of take the bull by the horns now and make life happen. Yeah.
Kathleen, there's a caller from Kalihi. I'd love for you to take this one. Are there signs that indicate someone's mental health status has changed? How do you approach someone? What do you say?
Well, I think some of the signs are basically if there's been a change in some patterns. So some of the typical patterns that I try to pay attention to is, for example, sleeping. We don't give a lot of attention to how important our sleep is. And especially when we have, just multiple agendas going on, busy days, lots of technology going on, sleeping and kind of winding down in the evening, and how we wake up. I notice that if sleeping is getting off, then that could be the sign of other things getting off. And so what we sleep, how we sleep, what we eat, some of these back to the basics. A lot of people are kind of doing a back to the basics as they want to get mentally healthy. And so if that's changing, that's kind of a symptom, could be alarming for some folks. We talked about coping skills earlier. Some people have lost some of their coping skills, or they've just kind of gotten damaged through this. And some of that is a result of trauma. So if people's coping skills, they're a little snappier, or have kind of lost the ability to negotiate or get along with others, it just seems like they're not doing as well. I do check that out with people, and I'm very cautious about how I bring it up. I'm thinking that maybe I'm noticing a little bit of a change, or it seems like you're reacting a little bit differently, or, and of course that depends if I'm talking in my personal life or my professional life, but it's kind of the same sort of honest reaction of I'm just noticing a change, and trying to really give the message of I care. I'm coming from a place of I care about you, and I'm wondering how I could help. But I really find it helpful to, same with if somebody's bringing that up to me, I'm kind of noticing that there's a change, or if I want to express concern, I'm concerned about you. So I go for the being open and honest and addressing what I'm seeing. And I think people appreciate that.
Tavia, I want to hear from you on how you think teenagers and young people overall are coping in healthy ways and unhealthy ways. What are some of the trends that you see just in your conversations with your own peer group and with your work with the Boys and Girls Club? How do you see, especially, younger kids, how are they coping with all of this stress? Because they must be feeling it even just from the adults in their lives.
Yeah, most definitely. So I'd say, starting with the younger kids, I definitely noticed a trend of it does, as Dr. Patel said earlier, they don't feel the effects until later on, and you can slowly start to see it develop. For example, take a youth that you still have to play sports. If they come to the club now and they'll be playing sports, they'll be doing fine. All of a sudden, one day they just snap out of it. It's things that progressively happen over time, and in terms of not even just younger youth, but it could also be middle, high school, even adults actually, now that I think about it. Would most definitely be that. In terms of teens, a big trend that I have been seeing is either substance abuse and isolation are the two major ones. In terms of substance abuse, I've never seen my peers personally in my close circle struggle with that just yet. But in terms of like external or like mutuals, I can definitely see the effects and how it's been wearing them down, how rather than making them feel, somewhat better through this pandemic, if anything, it's only bringing them down. But, that's what friends are for. They're meant to be there to help you and guide you through that whole process. But another one, in terms of the isolation, depression and anxiety definitely come hand in hand with that. Especially speaking from personal experience, I'm a university student. I've definitely been feeling the effects, coming afterwards, especially now since I just finished university actually today, my first year. The stress just comes afterwards. So I think just the major trend of things happening afterwards or feeling the effects afterwards, and how are we going to deal with that in the long term?
Kumi, let's talk about some of the state services that are out there. There's a couple of questions here. Randolph asked via email, are there adequate hospital beds for those who need psychiatric hospitalization? And following that, Tim in Kaimuki says, how much of the federal dollars that the state received went toward mental health support? Do we know, are there adequate resources?
I think Kathleen is better at answering that because she's from the Department of Health and she might know a little bit more about that.
Okay.
But there aren't enough beds. There is not enough funding. And we know that there's not enough providers. As Dr. Patel said, there's just not enough. And we know that at least 1 in 5 are struggling with mental illness. But we know probably since after this pandemic, it's going to be even more. So we really just do not have enough beds. We do not have enough funding. But Kathleen or Dr. Patel, if you could jump in.
I think we do have a concern about the fact that so many people have had this sustained period of adapting to the pandemic, and what are those results? When we go through this kind of stress for this amount of time, what's that going to look like? We probably will need more services. It's clear that there are not that many beds for people to take when they need inpatient care. So, we have a couple of main psychiatric units that tend to be full, and then we have our one large psychiatric state hospital, which it's constantly full and it's over full, and so that is a concern. And I think many advocates try to share that they try to get loved ones in there, and generally it means that you have to have some sort of court involvement to get in there, and so many advocates get very concerned that why does it mean that you have to have some sort of criminal involvement. And so that's a pretty sensitive topic among many people, that there's just not enough inpatient beds. And then what does that mean to our mental health situation when we're saying this is going to get worse? So that is definitely a concern. I think there are a lot of people that are looking at that, and a lot of people that are planning for that. What the state has done and has been very effective at doing this last year is creating some crisis stabilization beds. And so what that means is, rather than having people go to an inpatient setting, to be in a less restrictive setting and be able to maintain themselves in the community. So for example, have all the crisis supports be with them in a temporary setting, stabilize the crisis, and then get them back into their home, whether it's a group home or their family home. And so that has been a real focus this last year. And I think that's been an effective model to have little crisis stabilization units set up in different parts of the island, and looking at that and hopefully replicating that.
So, Dr. Patel, I want to ask you, sort of before it gets to the point where you need an inpatient experience like the one that Kathleen is talking about, at what point do you think it's appropriate for someone to reach out to a counselor, especially someone who may be watching tonight who's never had any kind of therapy? They might say, well, this is normal, this is stress, I'll just have another glass of wine tonight, or distress, and, whatever their coping mechanism is. But at what point do you think that someone should seek professional help? And if they do want to take that step, what is the best way to do that?
I think they should trust their gut. So if it even crosses their mind, there's no harm in reaching out for help. There's no harm in, trying to get a session or two with someone and just kind of talk things out. There may be things that if you're able to talk with a neutral third party that come out that you might not have been thinking about, or you might not have thought were connected. And it's always, I always recommend to try it. If you're thinking about it, it can only help. In terms of how to find an individual counselor, that's really difficult right now. I feel so bad for people because I think not a lot of, at least psychiatrists I know, are taking new patients right now. It's very tough. So I'm really hoping that this kicks off more funding for like community health centers, for CAMD, for the state, just to provide like these crisis centers and these crisis beds, things like that, because the individual providers, there's not enough. And then more funding for more psychiatrists in the future, more social workers, more psychologists, just in general. We're going to need it.
Yeah, and are visits like that, if you are able to find a counselor, are visits like that typically covered by medical insurance?
Most medical insurance in Hawaii, they're pretty good about it, and most are covering telehealth right now, which is awesome. And I really hope that gets maintained after this is not considered an emergency anymore. I think telehealth is sort of the way to go. People are really loving it. I personally like the in the office settings, but I think if people had the option of both, a lot of my patients are preferring the telehealth for convenience. So hopefully insurances will continue to cover it.
Can I also add something that a lot of families or individuals will call us and say, how can I find a therapist? So we do give them sort of strategies to figure out how to find a therapist. Oftentimes too, somebody will say, oh, I tried therapy and it didn't work. And I said, well, you can't just stop there. There's so many other options. You got to find the right fit. So keep trying. And then in the meantime, we provide support, we provide classes. So if you have to wait 3 months or 6 months for your appointment, connect to a group, connect to a support group.
Kathleen, I wonder if you would answer this call from YNI. It says alcohol sales have skyrocketed during the pandemic. Is this a bad sign for what we're discussing tonight? Is the state doing anything to track, to see any kind of crossover there between potential substance abuse and the issues that we're talking about tonight?
Yes, and I think that's a really important observation that our YNI friend is pointing out. So people are personally seeing it. You can hear it in your friends maybe, and in the community conversations, people are just noticing it. But yes, data is being collected, and we have a whole administration as a part of Department of Health with alcohol and substance use. So we can have more data-driven decisions. But yes, it's clear that it's going up. And so people tend to use that as a way to cope. Or use as a way to kind of self-medicate. It's a way to, maybe people are thinking that will help them feel better at the point, at that moment. But of course it just snowballs often, and then it leads into all sorts of other problems. So I'm glad that that person's bringing that up. It's a real concern, and there is treatment. There are treatment centers available. There, as Kumi mentioned, there's self-help groups also available. But again, it's something to reach out and try to get some help. Families often do some interventions to try to, get the person to stop or get some help. Many people, of course, we haven't touched on it, but there's a whole segment of our populations that don't want any help or don't think they have a problem. Mental illness, substance use, or most likely, many of our folks that are in our system have both a co-occurring disorder. And so when people don't realize they have a problem, that's even more challenging. But yes, I would say that substance use, I'm sure you're seeing it, is increasing.
Well, let's put those numbers. Let's put those numbers back on the screen for resources for people. And while we have those up there, can you tell us what people can expect when they call those numbers? What kind of help they can expect on the other end?
So they're going to talk to somebody that can screen about what kind of service might be helpful. Again, if you specifically ask for Kumekani, then you can talk to a counselor about how COVID is affecting your life right now. You can go to the Kumekani website and find out all kinds of groups that you could personally sign up to join through Zoom. Or if you stay on the line for Hawaii Cares, they could give you a resource to some sort of treatment center, to some sort of other resource. One of the best things about Hawaii Cares, I think, is that if you need a crisis mobile outreach team, if you actually need people to come to your home, your site, a team will come out and provide some intervention and help you get to a safe place. So sometimes, for example, if they're called, maybe the person needs to go to a crisis stabilization bed, a place, or a crisis center. Maybe somebody does need to go to the hospital. So you can call them for help to come out and be at your home to help.
Tavia, we've been talking about different ways that people have been coping. Can you tell us about some of the ways that that young people, that you and your friends and the people that you work with the Boys and Girls Club, how you've been de-stressing? What kind of coping mechanisms, what kind of things that you're employing there?
Yes. So a big one that I've been noticing is that a lot of them just have a lot of built up energy from being inside all day. I mean, from doing school remotely, you can already tell from just the look at their eyes that they just want to be outside and enjoy. As Dr. Patel said, living in the moment is what they want to do. I mean, they're kids. That's what they're meant to do right now. Well, a big one is definitely playing sports or doing outdoor activities. Another one that I think has been very helpful is journaling. As I said earlier, a lot of people don't necessarily love to talk about their feelings, especially the youth, because they're still learning how to digest their emotions. So writing down, whatever happens to them, what they may be feeling that day, anything that they saw, it could even be positive things too. Just writing it down or putting it out somewhere, whether it may be on paper or speaking to someone about it, has been very helpful for the youth.
Yeah, I mean, that seems like something that would be useful at any age. There's a comment here saying asking for help or even asking someone if they need help comes down to trust, friendship, and ohana. This is a time we need each other. Kumi, let's talk about this a little bit, because for so long we've been told to socially distance, to stay away from one another. Now we're starting to reemerge and to be with one another. How do we reestablish trust in those relationships? I know that in my own life, we were invited to a birthday party for the first time in over a year. I have young children. And it was sort of a surprise. And now I have all this anxiety about, do we go to the birthday party? How do we do this safely? Is it rude if I don't go? Like, how, so how do we get these social connections back so that we can have these conversations to say, hey, I notice that you might need some help?
Yeah, we were just talking about this in our staff meeting, that one of my staff said, I'm so anxious because I had to take my dog to the vet. And, and I saw on a TV show, and a counselor was saying, just think of the grizzly bear who's coming out of hibernation. The grizzly bear just doesn't pop out and say, okay, I'm back in the world. No, they peek out, they go back in. Sometimes they go back to sleep. They peek out, might take a nibble of a plant and then go back. They might explore a little bit more, a little at a time. And so it's kind of like just giving yourself some grace. Like it's the pandemic in reverse, right? Like we had to learn to adjust to be stuck at home. Now give yourself some time and some grace and just tell your friends, hey, I'm not quite ready. And I've said that. I said, I'm not quite ready. And people said, that's okay. I understand. And I think that's the Hawaii community. It's the aloha that we have here. that people are very gracious, and it's okay to be honest, I think.
Yeah, Dr. Patel, let's walk through a little bit more of that with you. How do we reemerge? And I like that hibernation analogy. I think it's fantastic, and it is very telling of what we're experiencing right now, because there is anxiety now with reestablishing these connections.
Absolutely. I love that example. That was great, coming out of hibernation. But yeah, really checking in with yourself. And I think with a lot of the patients I work with, they have anxiety and depression. So they've been in their head for a year, right? Like in their head, just lots of time alone for the thoughts to go everywhere. So now kind of it's this stage of checking in with yourself and getting those thoughts a little more focused and grounded. So I think figuring out what's really important to you, right? Like, there's a bunch of patients that I have that are introverts that have actually loved the year in isolation. And then there's the other extreme that are extroverts that have really missed it. So for those people who have really missed the connections, it's okay. So do I want to figure out how to meet up with friends first? Do I want to figure out how to get involved in activities that I've missed out on? But just really paying attention to yourself. And I think that's something that we can all learn coming out of this, is being more in tune with ourselves. And yeah, that idea of the hibernation coming out, I love that. I think I'm going to use that when I talk to people. That's great.
Sean on Facebook has a question, and I actually want to stick with you on this, Doctor. Any signs we should look for in young children that they are struggling? How can we tell in particularly little kids?
Absolutely. Change in behavior. That's probably the number one thing. The parents know their kids the best. So if they notice any sort of change, and a lot of times for kids, it's going to be aggression or irritability. If they're depressed, they're not going to necessarily look melancholic. They're going to be irritable, acting out, maybe aggressive, maybe tantruming more than usual. If we're talking like maybe age 7 and under. For a little bit older than that, maybe the tweens, it could also be maybe more sassiness, more attitude, more not listening, which is confusing, and because it's like sort of teenage stuff, but then it's more intense. But I think the parent trusting their gut, they know something's off, and then at that point, just asking for help or talking to someone about it.
And how do we navigate that? I have a 2-year-old and a 4-year-old. If I were to notice something in them that seemed unusual, and the tantrum count, that's not going to work in my house. Yeah. But I will say that there are parents who do know their kids, and maybe they do notice, as you said, something is off. How do we get in touch with a mental health? What are the steps that a parent should take when we're talking about very young children? We might know that it's appropriate for us to seek a counselor, but how do we know that it's the right time to seek a counselor for a child?
If you're noticing something different, it's the time. It's better to just try to, and if you can actually call, just maybe check with your insurance company, see who's taking new patients, or just look online and just call someone and just try to get an appointment. There's no right or wrong about that. I think as soon as you notice something, just try to get some help. You can even ask your pediatrician. If the pediatrician knows obviously they know the child really well, they might have a suggestion for you as well.
Kumi, I'd love you to weigh in on this as well, because I know that part of what you do is to help the whole family.
Yeah, so we usually recommend that they see their pediatrician, because first off, sometimes it's developmental, or sometimes it might be other medical issues. And so just rule that out. And if they can't get an appointment with a therapist or a psychiatrist right away, their pediatrician sometimes is able to do, Dr. Patel, you could clarify a little bit more, but they might be able to prescribe certain things or suggest certain things or strategies, or they might have a colleague or another doctor friend that says, oh, there's a friend that's taking new patients. So it's always good to check in with your pediatrician or contact us. We kind of know how to navigate certain people that might be able to take new patients. And the other option is, we love psychiatrists, but nurse practitioners are always great, because we can't get them to see psychiatrists very quickly, but maybe a nurse practitioner who has prescribing authority might be able to treat mental health issues. Or even some of these walk-in clinics that have sliding scales are able to take appointments more frequently and, earlier.
Linda has a comment here, says, a sincere mahalo to the panel for their service and work in helping our community. This is such an important discussion. We do thank you for being here tonight. There's another comment here, and Kathleen, I'd like you to take this one. Do you see indicators of the decreasing stigma of having the conversations about mental wellness? Any insight about how to help further decrease cultural stigma about discussing mental wellness? How are these conversations evolving over time?
Well, I've been having a lot. I think that there's been more people like you and PBS saying, let's have a conversation, let's discuss it. This May, is May Mental Health Awareness Month, and there's been some effort, I think, with anytime there's publicity and just newspaper, whether it's tweeting or, all these new social media platforms that some of us have tried to get better at, talking about mental health. I think that really does make a difference in decreasing stigma. I think that culturally, we are, especially Hawaii, we are so diverse here. And so we're always faced though with kind of how we're brought up and what our values are around how we talk about things like this. It is not popular to just go around and say, yes, I have diagnosis, I'm living with bipolar, I'm on this medication, that medication. It is not ever going to be probably just okay to do that. But I think it's easier, and I think people get more confident in recognizing that basically it's more acceptable to do, and that you're going to be okay if you do it. There will not be major discriminatory actions against you. There will not be horrible consequences. But that takes a lot of time for one to become more comfortable with kind of coming out about that I've either sought help or I have a diagnosis. So whatever the upbringing is culturally and kind of in our world today to do that, I really am grateful when people do that, because it makes a huge difference. I've seen it with my own eyes, and I just want to encourage people to be okay with that. And again, I want to thank you and the show for allowing this kind of platform for that. So I do encourage people to do that, but definitely it's hard to do.
Tavia, what are the conversations like, among young people on this issue?
Yes, so the main thing that I've been noticing is relatability. I think more than anything, if someone is a brave soul and decides to jump in and start the conversation, that's your starter. I think nowadays, especially, it's becoming a lot more normalized because a lot of people are starting to recognize, the signs, or if they're feeling any trauma coming up from their past. So relatability is definitely the biggest thing that's really bringing people together. And I think, with this pandemic, a lot of people are being able to relate to one another, saying, I've also struggled with, say, unemployment or struggling with family life. That sense of relatability is what brings us together as a community. And that's, the best that we can hope for, is doing this together.
Dr. Patel, Christine from Kihei says, is it possible to suffer from narcolepsy as a result of all of the stress we're experiencing right now? What kind of physical symptoms do we see? How do we see the stress actually manifesting in our bodies?
That's a good question. Well, the stress can manifest physically in lots of different ways. If we're talking about stress as anxiety, for example, it can manifest in any body system. I mean, you can notice it in your gut, you can notice it in the way your heart beats, you can notice it in how you sleep, how your appetite, all these physical ways. Narcolepsy in particular, I think it can be worsened by stress, if there is stress, if maybe there's a genetic predisposition to it. I'm not exactly sure if it can directly immediately be caused by stress. I think you have to have an underlying predisposition for it, but certainly it can manifest in lots of different ways. I mean, I have some patients who they have skin rashes, for example. They have definitely different kinds of problems with sleep. They have gut issues, all these kinds of things. down.
And how do we know if that is, is that something purely physical? I know that all of these systems are related, but how do we sort of drill down that, oh, this is because I'm stressed by the pandemic, as opposed to this is something that's happening with my body physically?
If if I'm seeing a patient and they're telling me about the physical symptoms, we kind of go through sort of the onset and the timing, and we try to look at when did the physical symptoms start. And for example, I have one patient who has these episodes where she passes out, and it can be directly linked to anxiety and stress and some of the trauma she's had. But I still like to say, let's have you go to your primary care doc and just make sure there's nothing else going on. But the thing I like to tell people is that it's still physical. Even if it's anxiety, even if it's depression, it's in your brain, it's still physical. There's still something physical happening. But I want to make sure it's not something that's a different system that I'm not an expert in, that we need to make sure it's not that.
We only have 5 minutes. The time goes so fast. So I want to get to each of you for just about a minute. Just your closing thought. What is one thing that has helped you personally, or that you've seen success with in coping through the pandemic? Dr. Patel, we'll start with you.
Dinner with my family every night. For sure. That is the grounding technique. Wouldn't miss it.
Okay. And Kathleen, how about you?
I think striving for balance, just really focusing, being mindful about having balance. That's been very significant for me during this.
Okay.
Thank you.
Tavia, how about you? What is something that's helped you get through this last year? We know that, as a college freshman, but doing this remotely and then helping to support others, it's certainly a lot.
Yeah, I'd say the biggest thing is purposefully setting time for yourself each day, whether it may be 5 or 10 minutes. You need that time to be able to introspectively look at yourself and analyze, am I doing okay today? Is there anything I could do tomorrow that can help me feel better? So setting time for yourself is the biggest thing.
And Kumi, what about you?
I would say boundaries are really important, especially if you're a caregiver. I've had to say, I'm sorry, mom and dad, you're going to have to eat dinner on your own because I'm going to go for a swim. I'm going to go out for a walk, because it is just so challenging working and taking care of a family.
Yeah, it is. I want to throw up those numbers for folks to call just one more time tonight. And Kathleen, we can, as we put up those numbers, we'll give you the last word. If you could just speak to the strength that it takes to ask for help, either on behalf of yourself or someone else.
Yes, thank you. So it is not a weakness. Please ask for help. Please identify if you have a need, and for yourself or for somebody else, please go ahead and ask for help. You are not alone. There are resources for you, and we're here for you.
Okay.
Please make that call.
And we want to read those numbers for you if we could. Oh, they went away. There they are. On Oahu, that is 832-3100. On the neighbor islands, it's a 1-800 number. It's 1-800-753-6879. They're open 7 days a week, and we do have a few more minutes, the time. And so, Dr. Patel, I know that you said that it can be difficult to connect with a counselor, but if you are trying to make that call and you are able to get through, it is somewhat of an interview process, if you will. What are the questions that you should be asking a provider?
So you should be, when you go in to talk to someone or via telemed, kind of know what you're looking for. So for example, with psychiatrists, there are some psychiatrists who focus mainly on medication, just medication treatment, right? But I like to do talk therapy and medicine, so kind of know what you're looking for. If you're looking for talk therapy, know the kind of talk therapy, maybe do some research about what you want, so you know when you go in to talk to the person that it's a good fit.
Okay, wonderful. And Kumi, I'll give you the last word tonight. You've talked about taking care of your family, for your parents, and then also for your children. What is the best advice you have for how to take care of yourself? I know you said that setting boundaries, that's so important.
Mm-hmm. Yeah, so if you can't take care of yourself, you can't take care of anybody else. And so then you got to put on the oxygen mask first, and then put it on your family. So it really is really fine-tuned for me since the pandemic. It's something I've really, really embraced.
Okay, we appreciate all of your insights tonight. You all were wonderful. Thank you for speaking so candidly. We really appreciate it. We want to thank our guests, Kathleen Merriam, team leader for the Kumakani Hawaii Resiliency Project, Kumi McDonald from the National Alliance on Mental Illness, psychiatrist Dr. Sonia Patel, and college freshman Tavia Raposo. Thank you so much to all of you for your candor and for speaking so openly about this issue. Next week, right here on Insights, they are some of the most vulnerable people in society. We will be talking about at-risk youth. Unfortunately, the pandemic has put added strain on programs aimed at helping our keiki. So we're going to be checking in with some of them. Please do join us then. And again, if you or someone you know is struggling with mental illness right now or just needs someone to talk to, please do take advantage of the resources we talked about tonight. I'm Yanji Denise for Insights on PBS Hawaii. Take care of yourself. Aloha.